Part B of this DVD is to show how we as health workers can help mothers to breastfeed successfully. It gives some suggestions of how we can talk to mothers to make them feel encouraged and confident about breastfeeding. We will also see a demonstration of an experienced midwife helping a mother to position and attach her baby at the breast. Breastfeeding is important to child survival and saves newborn and infant lives. It is up to us as health workers to do as much as we can to encourage mothers to breastfeed. The World Health Organization recommends that the ideal way to feed most children in the world is exclusive breastfeeding for the first 6 months of life and then continued breastfeeding until they are 2 years of age. Exclusive breastfeeding is being encouraged in all countries in the world, not only in Africa. This is because health workers recognise the enormous benefits of breastfeeding to children, mothers, and society in general. Occasionally, there are medical reasons that a woman cannot breastfeed. These include women who are HIV infected, have received appropriate counselling, and have chosen not to breastfeed. However, we must remember that the current recommendations for HIV-infected women are to exclusively breastfeed for 6 months, unless a mother can prepare formula feeds in a safe way, has the money to be able to provide milk for her child for the first 2 years of life, and that it will be acceptable for her family if she does not breastfeed. Recent studies, including studies in South Africa, have shown that if an HIV-infected woman exclusively breastfeeds, the risk of passing on HIV to her child is small and much lower than if she mixed feeds.
So a hypothesis which the Wellcome Trust was generous enough to support was that can we show scientifically and in an absolutely reliable manner that this issue of breastfeeding could be safe in HIV-infected women. For about 6 or 7 years, we have gone to extraordinary lengths to do a scientifically sound study with which very few people could have problems about the science. And what we have shown now, if you breastfed exclusively with nothing else for 6 months, breastfeeding by HIV positive mothers, the risks of transmission are very, very low. That exclusive breastfeeding for 6 months is a very safe option. It reduces the risk of transmission, which means that 96% of the women who breastfeed like that do not transmit the virus. And the fact is that those babies don't die from what I pointed out that they would die from if they chose formula. That is, they get malnourished, they'd have diarrhea, and they would die.
Unfortunately, many women who start to breastfeed give up exclusive breastfeeding. They soon start to give other things like formula milk or glucose water. They feel it is too much to carry on, they do not get the help they need, and are sometimes worried about asking us as health workers for help. In order for breastfeeding to be successful, a baby needs to be well positioned and attached at the breast. There are 4 key points of positioning and 4 key points of attachment. The 4 key points of positioning are: 1. That the baby is in a straight line and that the head is not twisted. It is difficult to drink if your head is twisted to one side. 2. That the baby is held close to the mother. 3. When the baby is small, and particularly in the first few weeks after birth, support the whole body of the baby. 4. When the baby is put to the breast, his nose should aim for the nipple. In that way, his mouth will be in the right position to attach well to the breast. The 4 key points of attachment are: 1. The baby takes a good mouthful of breast. More areola should be seen above the baby's top lip than below the bottom lip. For many women, most of the areola will be inside the baby's mouth. 2. The baby's mouth should be wide open. 3. The lower lip should be turned outwards and not inwards. 4. The baby's chin should touch the breast. When we help a mother to position and attach her baby, we should let the mother do this for herself as far as possible. This means that she will be able to do it on her own next time. We also need to remember that mothers are tired and emotional after delivery. The way we talk to a mother is important. Try to be gentle and patient, taking time not to rush the mother. Sometimes as busy health workers, we use words which can sound harsh to a mother and may put her off asking questions when she needs help for fear of disturbing our routine. It is a good habit to try to use open questions when talking to mothers. So, instead of saying, rather say, this gives the mother time to say how she is really feeling. Open questions are those to which a mother cannot simply say yes or no. She has to give more information. Let's look at another example. Instead of saying, rather say, mothers will talk more if you look interested in what they are saying. Try to look at the mother and use body language which shows you care about her and any breastfeeding issues she may have. Often mothers say things about how they are feeling. For example, they might say they are tired, they're sore, breastfeeding is painful, everything is too much for them. It helps if you can empathise with how the mother is feeling. Show her that you understand how she is feeling. For example, this mother is very tired. Note how Sister Tembi empathised by saying, "You're feeling very tired at the moment." Sometimes mothers say things which we may not agree with. For example, a mother might say that milk is produced when a mother eats a big meal. We know that it is a suckling action of a baby that produces milk. Try to accept what a mother says and feels without necessarily agreeing or disagreeing with her. You can correct her mistaken ideas later in a gentle way. It is always a good idea to find something to praise a mother for. There is always something a mother is doing well. Breastfeeding takes a lot of commitment and effort, and it is encouraging for a mother if you do not only find things to point out which are wrong, but that you also take time to recognise what is going well. Examples of things you could say include,
Siyabonga nanokuthi ukwazile nokuletha umntwana eklinikhi namhlanje. Siyabonga. Bomletha njalo ngeinsuku lezi simdinga ngazo.
Now, let us watch Sister Tembi help a mother to position and attach her baby at the breast. Listen to the way she uses her counselling skills. As you watch, look for the 4 key points of positioning and the 4 key points of attachment. This mother was finding breastfeeding painful. Her baby had been sucking on the nipple, causing cracks. Patience and time is needed to help this baby to attach well, open her mouth wide, and take a good mouthful of breast.
Sizokhombisana-ke imbali ukuthi umntwana ubanjwa kanjani ukuze akwazi ukuthola ubisi ngendlela efanelekile. Okay? Alright. Kunganjani mhlambe sithi ukunciphisa oblanket kancane. Mhlambe sithi ukukhipha lo umhloshana kusale lo bovu kuphela.
Okay. Tembi is taking her time to make sure the mother and baby are comfortable. She is making suggestions and letting the mother do things for herself. Tembi is not trying to take over.
Ngithi-ke uma ngabe umntwana kufanele ukuthi athole ubisi lonke khona ezokwazi nokubamba kahle ebeleni, umzimba wakho awuqonde. Awubona-ke uqonda umzimba wakhe nekhanda lakhe lingatshekeli eceleni ngoba nakuwena nje umuntu uyaphuza ikhanda litshekele eceleni aphuze kahle, angithi uyayibona la. Wena uhlezi kanjani mhlawumbe siqale lapho. Awubona-ke ungafuna ukuthi uhlale nje ukhululeke. Umzimba wakhe ukusekeleke kusukela elokhuzene ekhanda ukuze kufike awubona-ke waze wenza kahle wembali. Bese leli sinye isandla ke sekuyisona ke esibamba ibela. Ngithi umntwana wakho athi ukuphenduka kancane nibukane izinkaba zenu zithintana. Mhlawumbe angabe phezulu kakhulu athi ukumehlisa kancane. Athi behla futhi kancane asondele kuwe nawe ukhululeke nje ngamahlo. Ukhululekile? Ukhululekile? Okay. Ngasikhathi esesondele kuwe ke lesi sinye isandla ke sesokudla sesithatha ibele, angithi kusho ukuthi enozikhombisa ibele noma ngezokuncela. Kusho ukuthi asesiboneke la ekumbambeni ikhanda lakhe liqonde. Ake sithi umehlisa kancane. Kunjani masithi umehlisa kancane? Inkaba zenu zithintene? Okay. Ikhanda lakho liqondile nomzimba?
Qondile.
Useduze kwakho umsondezela ngithi? Wena ukhululekile?
Ngikhululekile.
Awubona-ke. Kusho ukuthi ingono yakho mayiqondane nekhala lakhe. Angithi yebo? Iqondane nekhala lakhe. Kusho ukuthi ingono ke le angithi uyayibona ithi ukuqondana nekhala. Angithi yebo. Uyazi ukuthi sikwenzelani ke lokho? Senzela ukuthi mase ekhamisa ingono ikwazi ukuthinta la olwangeni lwakhe. La elangeni lakhe la phezulu. Angithi uyayibona leyo nto khona izokwazi ukuthi abese yakwazi ukunkamfula abambe kahle ibela. Ngithi uyayibona leyo nto. Angithi uyabona. Angithi bese ke ukuba ngathi uyamletha angithi ake kuthi uyancela manje. Ngasikhathi ingono isekhaleni bese wena ubengathi umletha kulo ibela. Angithi uyabona lo. Ake sithi ukujana asithi sizama ukuthi sithi awuthi kumhlehlisa awuthi angithi maliqondane nebele ngasikhathi esekhamisa usuyamletha umletha kwena. Umlethe kwena ke iyayibona into ukuthi nje uleleke njengamanje akadingi ukuncela kodwa into efana naleyo uyayibona. Kukhona-ke ukuthi kwesinye isikhathi umntwana angafuni kakhulukazi abantwana abasuke bebancane kakhulu uthi uyazama ukumfaka ebeleni uthola ukuthi akawuvuli umlomo. Uyayibona leyo. So indlela yokumkhuthaza-ke ukuthi avule umlomo ukuthi ubambe ibele.
Although the baby is sleepy and not keen to feed at the moment, Tembi takes the opportunity to explain to the mother ways to encourage her baby to open her mouth.
Ngasikhathi sewuvula kakhulu ke umletha kuwena ke yenza umletha kuwe abese yangena abese yancela. Uyayibona leyo.
She also talks to the mother about ways to hold her breast for feeding.
Ngibuza ukuthi ngalibamba nibele kanje.
Umbuzo omuhle kakhulu lo. Kahle okuncomekayo ukuthi ulibambe imino yakho eyu4 ibe ngaphansi. Awubona-ke isithopha sibe ngaphezulu. Sikwenzelani njalo lokho? Asifuni ukuthi ebese kuthi le ndawo le emnyama imthambo lethwala ubisi ebese iyacindezeleka lungabe lisaphuma ngendlela yakhona. Uyabona? Uthi ukuhlehla ungasondeli kakhulu ebeleni endaweni lemnyama. Awubona-ke? Awubona-ke. Angithi uyabona ukuthi umntwana usenendawo eningi yokuthi ancele akwazi ukubamba le ndawo emnyama eningi ingene ngasemlomeni.
A little later, the baby woke up and wanted to feed.
Ukuze imbali umntwana akwazi ukuncela kahle siqale simgabisele emlomeni khona ezokwazi ukuthi awuvule kakhulu umlomo. Asizameke. Awubona-ke? Yabona-ke ngasikhathi uvula kakhulu umlomo usuyamletha kuwe.
If a baby is not ready to feed, there is no use forcing the breast into the baby's mouth. Note how Tembi is being very patient. This helps to create a calm atmosphere and the mother and baby do not feel stressed.
Kasho ba igama lakhe? Amahle. Amahle. Vula umlomo sesi. Ungamvuli ngebele ehewule kumgabisela kanjani. Ukuthi amahle ngimbonile mina kodwa yakhamisa ke amahle. Nasiya. Amahle. Ngoba akuze kungasiza ukuthi angakhamisi ngoba usuke bese ebamba ingono kuphela ilesikhathi bese sithola ukukrayeka kweingono kuba nakya.
Sometimes health workers are tempted to push the back of the baby's head to force them onto the breast. This is not a good idea as the baby will become very upset and fight back. Remember, this baby had previously been sucking only on the nipple, which was very painful for the mother. It will take patience to help this baby to learn to open her mouth wide. If all mothers are helped with their first feeds soon after delivery, we can make sure babies are well attached from the beginning, and nipple sucking and pain can be avoided.
I'm putting the foot. Akamisa atukamisa. Akabangisa kamisa ngendlela yakhona. Mengakamisanga kahle umlomo lo ongenzansi usuke bese ufonqaka ngaphakathi. Ngaleyo ndlela bese ngakwazi ukuthola kahle ubisi alidingayo. Kunjani uncilisa manje? Uzwa kunjani? Ngathi khamba kahle. Okay. Khona la kubuhlungu khona?
Yebo.
Kubuhlungu. Ngoba kabambanga kahle. Ilento ade ngisho ukuthi usuke bese udebelwa ngenzansi ufonqeka ngaphakathi uyayibona leyo bese kuba buhlungu ke. Kubambeka ingono kunokuthi kubambeke le ndawo emnyama eningi. Uyathanda ukuthi uqale phansi futhi? Akasafuni kodwa uzozo mangabe ukuthi usebambile ngendlela yakhona.
A little later, the baby reattaches to the breast, taking a bigger mouthful.
Ngasikhathi ukusho ukuthi ene uyalithola bisalidingayo. Udebe seliyaqala ke sengathi liyayiqaqala lo. Angithi uyabona ke nesilivu masithinte lapha ebeleni sesibona impela ukuthi ubambe ngendlela kuyiyona yona. Kunjani manje? Akusekho buhlungu. Uyaxoxa manje. Umthetho wakhe uyashesha yini ukusutha vele?
Ubele dlale ngalo kanje.
Athi kungehlisa ke sibona. Ayithali ngani. Ngibona ngathi sesizele. Wesisuthi njalo. Athi sibone athi simgabisele sibone ukuthi usathanda yini. Umlethe kweni khumbulo kumlethe kweni. Umgabisele akhamisa nakho. Kanti usancela. Khina mungangambambela mangabe ebambe wezwe ukuthi ubambile indawo yonke lemnyama. Angithi uyabona ke ukuthi umekhamisa kakhulu ungena yonke bese nesilivu sithinta la ebeleni asondele kuwena ileyo ndlela ke sesibone ngayo ukuthi kubambekile.
This mother felt breastfeeding was more comfortable than before. With more practice, her baby learnt to open her mouth much wider and suckle effectively. This baby was exclusively breastfed for 6 months, and Mum's cracked nipples healed well. When a baby is well positioned and attached, breastfeeding feels comfortable and the baby looks contented. There are very, very few women who cannot physically breastfeed. Many women who give up breastfeeding could have breastfed successfully if they had the right help and encouragement. Breastfeeding is generally a rewarding and pleasurable experience and forms a trusting bond between a mother and baby that is there for life. With our help, breastfeeding will get off to a good start from the first day of life, and we will be helping to improve child survival in our communities and country.
Phambili nomama nengane phambili 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 nomama nengane phambili phambili ngiyabonga